Hope you can see the presentation that I'm sharing. I'm not going to spend a whole lot of time on this today, but I did want to kind of go over some of the highlights of the gym and fitness center directives and how those are implemented. So first, a little history on COVID-19. I'm not going to get too far into the weeds on it, but just to kind of sum up, it is a respiratory illness that's caused by the virus SARS-CoV-2. It's transmitted primarily by respiratory droplets that are expelled when you cough or sneeze or breathe, and then those are breathed in by non-infected people, and they subsequently become ill. It can also be fomitic, which means that it's transferred by touching surfaces. So we don't need to disregard the role that surfaces may play, although we don't think that that's the primary way that that it's spread. So the general prevention methods, these are the methods that we've been preaching for the past 8 months. 6 feet distancing, cover your coughs or sneezes with a tissue, wear cloth face coverings when you're out in public and can't physically distance. Don't touch your eyes, nose, or your mouth. Clean and disinfect frequently touched surfaces. Stay home when you're sick, and wash your hands often. So, we've abbreviated that down recently with this graphic, which is remember the 3 W's: wear your mask, wash your hands, and watch your distance of 6 feet. So those are the 3 core principles that you need to make sure that you're following in your facility. So a little bit about the directives. The directive does require that all staff and participants have to be screened. And so that means when they come into your facility, you need to ask them, have they had a fever greater than 100.4 Fahrenheit in the last 2 days? Do they have a cough, difficulty breathing, sore throat, or loss of taste or smell? Have they had contact with a person known to be infected with COVID-19 in the last 14 days? And then in addition, staff have to have their temperature physically checked by a digital thermometer. So it's not just asking them the questions about fever. For staff, you actually have to take their temperature, and anyone with a temperature greater than 100.4 should not enter. Face coverings are required for all persons who come into the facility, except when they're actively exercising. We also exempt children under 10 years of age. I would highly recommend for some activities that are low to maybe moderate intensity, continuing to wear those face coverings if at all possible. If you're just walking on the treadmill, let's go ahead and keep that face covering on if possible. It's going to do quite a bit to knock down those droplets and try to keep that from spreading. We're also going to maintain 12 feet spacing between each person. If necessary, you can use an impermeable barrier between pieces of equipment. So, and if you do that, you can go down to 6 feet between the people or between the pieces of equipment, but the barrier has to be the entire length of the piece of equipment and has to be in front of as well as to the side. We also need to have signage posted at all of our entrances that tells the public not to come in if they have symptoms, same symptoms as listed before. The signs have to be posted at all entrances telling the public that they may not want to come in if they are over 65 years of age or they have underlying health conditions, including high blood pressure, lung disease, diabetes, obesity, asthma, or weakened immunity, as these individuals will be more susceptible to severe complications from the virus. And then, of course, we do require that hand sanitizer be available throughout the facility. We also ask that frequently touched surfaces need to be cleaned after each use. So if you're using exercise balls or equipment or weight sets or anything like that, those have to be cleaned after each use, and you need to use a product that has an EPA approved label stating that it has that it controls emerging viral pathogens, and you need to make sure you follow the manufacturer's instructions for these protocols or for these products. So each one of these products has a different contact time and a different concentration in order to be effective, and so you need to make sure that you read the label and understand how to use that product. You should also make sure that personal contact is avoided at all times, although for weightlifting, spotters may be present there for safety reasons, but otherwise we don't need to have any personal contact in the facility. And then for individual training sessions or indoor fitness classes, you have to maintain 12 feet distance between each person. So some other considerations, these aren't necessarily listed in the directives, but they are things that you need to consider in your facility to make them safer. So airflow is a key player in this, right? So if these droplets are suspended in the air, the more times that we can get that air circulated through that building and try to disperse that as best we can, the better success we'll have at stopping the infect or the spread of the disease. So we got to have adequate turnover to the facility. We can open exterior doors and windows as long as it's not too cold outside or too hot, and provide 30 minutes between classes to allow for the air to completely exchange out of that room before the next session. We also can limit the size of our classes and or have multiple classes per day to reduce occupancy at any one time and provide that physical distancing. And another option that a lot of gyms are using is to offer a live stream or a virtual class to keep their participants engaged, but let them participate from home, which is definitely safer. So quickly, how to calculate indoor capacity. So you take the total square footage of the room, you subtract any physical objects that are in that room, and then you divide that by 144 square feet, which would give you a 12 by 12 foot square. And so for an example, a yoga class is held in a 40 foot by 40 foot room with equipment and tables on 2 walls, which take up about 400 square feet. So the total space of the room is 600 or 1,600 square feet. We subtract 400 square feet to get 1,200 square feet, and then 1,200 square feet divided by 144 tells us that we can have 8.33 or 8 people in that room and maintain our physical distance. Quickly, all of our directives are available here. You may want to take a minute and take a picture of that link, or I can make the PowerPoint available after this session's over. And then also for there's entry signage that's required, and you can get that at the link there. And with that, I'm going to remind you again of the 3 W's, which is wear a mask, wash your hands, and watch your distance. And then I'm going to open it up for questions, and I hope y'all have a lot, because it was my understanding that there was quite a few questions coming through, and so I'm here to answer any of those that you have. Thanks. And you can place those questions either in the chat, or you can unmute yourself and ask them.
Hey there, this is Caitlin. I'm with Zen Studio. Apologies if there's some background noise. I'm in the studio and a class is about to start. But my primary question is regarding if someone who is infected reports that they've been here, like within the 2-day time frame or whatever it is that being tracked somewhere? And would we be notified if if there were multiple cases, or even if one person at a time? Because we haven't been, we haven't had that happen. But I just want to be sure that we're doing everything we can on our end to be notified, or to make sure that we're in the know just in case something does happen.
I'm not real familiar with that, but I'll answer this the best that I can. So if part of the directive requirement is that you maintain a log of people, and I failed to put that into my presentation today, but there is a requirement that you maintain a log of the people who come in. So, if we start seeing that there are probably one, we won't notify you, but if we see that there are more than one and we think that there's transmission going on there, then yes, we will contact you and we'll ask to see that.
Okay, great. That was my question. Thank you.
Hey, Caitlin, this is Diane. Other piece to that is also, since I work in the healthcare setting, it makes it a little bit different. But one thing we've noticed is that it's important to iterate to your public the importance of notifying you if they should test positive. Lots of times now we're finding out more and more people are not notifying the places that they've been. And I'm not saying, every store you went in or anything like that, but primary places, and a gym would definitely be a place that you would be more than one time, I would assume. So, and with that comes then there's part of the CDC guidelines along with the state health guidelines that ask you to notify state health, and then from there they determine whether or not they need to do the process of searching and see who might have been infected and check others out, in the area. But I think one of the things that is important, and I've noticed we've started putting our signage up and stuff. Please let us know if you meet any of these, directives, like have you had a fever of 100.4, are you coughing, is your chest hurt, the normal questions. And I think if you can develop that relationship with the people that you serve, you're likely to get an answer saying, oh my gosh, I just found out I've tested positive and I wanted to make sure that you guys knew. And then along with your logs, it's important that you do those logs and have people sign in the date and time when they were there, because then that helps us to do the search process if we have to go out and find out. And it helps also to cut down on the actual spreading of the COVID, if that's even possible right now, but you hope that it is. And I think if more people were be let known that, you did test positive, it helps us to move through the processes and try to squelch it a little bit quicker. Just some guidance.
Absolutely. Yeah, no, thank you for that. And we've, knock on wood, we've been contacted by individuals, but definitely can reiterate, to be sure to let us know that it just hasn't been, I've been kind of a doomsdayer, so I've been expecting the worst, and it hasn't met my expectation yet. So I just wanted to be sure that if there was something being tracked, that we would be in the know in case we did need to intervene on a higher level.
And I think there's some different processes now, and Jeff, you may know some about this too, but they have a high risk category. So if you came in contact with someone who was positive and then you turned around and were tested, but you tested negative, for example, in the healthcare industry, we're still having them at our particular facility because that's our procedure. They sit out for 10 days in quarantine because they're deemed high risk. And what that means is maybe they were within 6 foot of the person who tested positive. They didn't have their mask on. They didn't have eye protection on, that type of stuff. And that can cause problems, and of course, for everyone else. And don't think hospitals don't have problems, because it's affecting us and our employees as well. And it makes it very difficult when you have a certain amount of staff to take care of a certain job and you lose a third of your staff due to quarantines and positive testing. So just another bit of advice there.
And we are tracking, Caitlin. Everyone's working together, health centers, hospitals,
Right.
Department of Health, we're all tracking. So if you have someone that comes into your facility and they think they had it last week and didn't say anything, letting us know is important so we can track it. Thank you for sharing your number, Jeff. Thanks.
Yeah, that number is the COVID hotline number. So if you have a patron or an employee even that comes to you and says, I've tested positive, just wanted to let you know, call that number, 1-800-803-7847, and someone will be there to take your information and make sure that someone gets back with you and gives you good guidance.
And they will get back with you, because on some of my employees, I receive phone calls, even on a couple of our vendors that tested positive. I got phone calls asking, how close were they? Do you know anybody else they might have come in contact with? That type of information. So the health department's doing their job. It's up to us as individuals to help them too, and to help to prevent the spread of it.
And having the thermometers, I really want to hone in about checking your employees' temperature daily. It's not, oh, they were good on Monday, so I don't have to check their temperature the rest of the week. You need to check your employees every single day, because they don't just come to your facility. They go to the grocery store, they go to Walmart. Some of them are still meeting in groups of people. So it's important to also check your employees that are working there in the facility as well. Do we have any more questions?
Sarah, if you'd like, you can ask me some of the questions that you've been receiving, specifically about the yoga studios,
Yes.
and I'll be willing to answer those.
So in a yoga studio, because they're breathing, and that was the question, do they need to wear masks while they're teaching a class?
I would say yes, if at all possible. I mean, if your respiration is so high that the mask is inhibitory, um, then by all means you can take it off as long as you're maintaining the 12 feet distance. But you know, if your body is capable of doing the poses and the things that you're doing without gasping for air, then you should be fine to keep wearing it. And I would if at all possible. For example, I'm a bowler as my exercise activity, and bowling, you can easily keep your mask on while you're bowling. And so I do that when I do bowl, but I really haven't been bowling much in the pandemic, only when someone really needs a sub or something. So.
Yeah, that was one of the questions. It's like as long as they have distance. And so one thing you talked about was the 12 feet distance. So in a facility, the square footage, so if they have let's say 1,000 square feet, how many people really can they realistically have in there?
Not a lot. The one I gave just a minute ago was 1,200 square feet, and it was 8 people. So 1,000, you would probably be maybe 7.
Okay.
At the 12-foot spacing. So yeah, I mean, you're going to be severely limited in the number of people that you can have in there. And the increased spacing, I didn't really hit on that, but the increased spacing is because when you're exercising, you're respirating more heavily, and you're more forcefully forcing those droplets out. And so we've got to have that extra space to give those droplets time to either fall to the ground or disperse within the room to where they're not a high enough concentration to necessarily cause illness.
So what should they be using to space out their 12 feet distance? I mean, some people have been using rulers, some people have been using their own feet and saying, okay, this is 12 feet. What should they be using to space out?
Basically using a tape measure or a ruler or something to measure actual 12 feet. If you're in a room with floor tiles that are 1 foot wide, you can use the floor tiles because they are exactly 12 inches wide. But for the most part, just stick with a tape measure.
Okay.
Don't estimate it, because the numbers are 6 feet for a reason, and so we need to stick with that.
Hey, Sarah, what I think works too in that arena is to use the blue masking tape or something that doesn't leave a residue on your floors and mark it out. That way there's no question. Here's your X, and you've got it all lined out. Saves time, because that's also more time you're taking into your classes if you've got to figure out your spacing each time. And like Jeff said, you've already got the footage involved and you already know what it is. So you can figure it out ahead of time. You got it marked and you're good to go. And we do the same thing, with the things that we're doing here at the hospital. If we need that spacing, we've already done it before we actually teach the class or do anything else.
Should they be checking people's temperatures every time they come in?
We do them once a day, but some will say, if they're coming in multiple times in a yoga or gym atmosphere, and I saw Jeff shaking his head, I'd say definitely.
It takes.
They're coming and going.
It takes less than 3 seconds, so just go ahead and do it.
Yeah.
Besides that, it will foster or it will give the impression to your people that you're doing your due diligence. If you have some people who are not being screened, oh, he's already been screened, that doesn't really work well in the general public. So I would encourage you to go ahead and temp everyone as they're coming in. If they leave and come back, then they need to be temped, or you need to have some sort of a
sticker put on them
or something that acknowledges that they've been checked already.
Are there any other questions? Those were the ones I've gotten from other studios. So thank you for covering that, Jeff and Diane.
I just think one thing that we could reiterate to people is that the leaders, the people in charge, they need to be setting the example to the people that they are serving. It'd be for me, for an example, I could come in through the lower parking deck and never go through the emergency department entrance and be tested every morning. Would someone know? I would know. And to me, I feel like if we can't lead by example, then we're in the wrong career fields. And it doesn't matter what career you have. But you have to set that example if you expect others to follow you, because if not, it's not going to happen. And that's when you run into problems and you can actually, spread it out there a lot more than it ever needed to be if we just did what we were supposed to do. And that's the hard part for people to understand right now. It's serious. And, I hate to keep saying this, but if you work in a hospital and you see what these people go through, and you talk to your friends, and I've had people tell me they have never in their life been so sick and they didn't know if they were going to live or die. And then you see what happens in healthcare. And guys, this can be a horrific death. And I'm not just saying that to say it. You're talking your lungs, your breathing, and the fact that you can go into pneumonia and blood clots and so many other things. It's just not a pretty sight. And then some are, recover and they're fine. And then others, we'll see them 6-8 weeks later, they're back in the hospital and they're positive again. And that happens because your immune system just gets beat up and it's so wore down that you are so susceptible to these things. And I think even now, people don't understand. Yesterday, there were over 2,000 cases again in the state confirmed, 1,100 positive, 800 PUIs, persons under investigation. That's ridiculous. 20 more deaths yesterday. This is a serious thing and it's not going away. And I really feel we have got to get on top of it or we're going to be sitting here going, what happened? And there's no reason for it.
Right. We have a question here from Pam. She says, so if a yoga teacher is wearing a mask, should they also be wearing eye protection?
Yeah, so the directive doesn't require eye protection. The overall guidance that we give is to avoid hand contact with your eyes, nose, and mouth. And that is because you could potentially become infected through contact with your eye if you had the virus on your hand. We also, are requesting eye protection for nurses and things that are dealing direct with patient contact. And so, if you're not doing direct patient contact or direct student contact in this case, I wouldn't think that eye protection would be required. But if you feel comfortable wearing it, by all means, go ahead.
And the difference too, Jeff, is that 12 feet. That's huge. Right. And that makes a big difference right there. And he's right. It's patient care, direct patient contact, that type of stuff that requires the eye protection right now.
She says, thank you. You're welcome. That's a good question because sometimes, you're teaching and it's that distance that you're going to try to keep distance from people just like you would in everyday life when you're standing in line at Target and they have the dots, when you're at the Lululemon store and they have the dots and they're saying it's the same distance. And so if you're keeping that distance away from your students, then you're safe. But if you feel like you're going to be up close, you might want to do that. I think also people are thinking about your front desk people who are checking in. I think that would be a suggestion for your front desk people check in to wear eyewear because you have people coming. The desk is it's not 6 feet distance in a lot of places. So you might want to have your front desk person wear eyewear to protect themselves as they're checking people in. If your front desk person is going to be the person checking people's temperature, so they're going to have to get a little closer, especially if they have a handheld one. So they would need to wear the eyewear, I would believe, to stay safe and be completely safe from possibly spreading or getting COVID. Okay, I think that is all our questions. Yeah. They said definitely I will. Yeah. Pam's one of the front desk people, so that's why I was like, yeah, you would need to, because you're checking temperatures, you're checking people in, they're close to you, they're about three to 4 feet close to you, and you have to really protect yourself. Yeah.
And a lot of places are using partitions. They may have made them out of plexiglass or something like that so that you can still see through and have that contact with the person, but then there's a separation there. And that's a huge asset, you know, when you do that kind of stuff. So
Yeah, I would say that, you know, while we don't consider that plexiglass as a substitute for distancing,
yeah.
there may be some benefits to it that we really don't have any studies to show plus or minus, but it's got good merit as being something that would potentially have a positive impact. So I would go ahead and recommend those.
All right. Do we have any more questions, comments from you, Jeff or Diane? I feel like we covered it all.
I think pretty much. Hand washing, can't do too much of it. Make sure you have lots of sanitizer available. It's everywhere now. For a while, it was kind of scarce, but I'm seeing it back in the stores again. So please ensure that you have it. If for some reason we get a critical shortage of it, you might reach out to some of your coalitions. For example, in this area, we have the Metro Healthcare Coalition, and Sarah can help you be put in contact with those of us that are involved. And we can always help with that type of stuff if you're having a difficulty in acquiring the hand sanitizer and those types of things.
Yes, I'll follow up with, you know, the last thing that I said in my presentation, the 3 W's: wear your mask, watch your distance, and wash your hands. Those are the key points that we've been trying to drive home for 8 months, and we're going to keep driving them home until we're out of this thing. So, and even after that, watching your distance and washing your hands is a pretty good idea, just in general. So.
I will send a recording of this to all of you. You will be able to share it. I also will put the recording on Community Health Center's website as well, so you can get it and you can share it, and share it out to the community. Really share it with the fitness community, Orange Theory, all the yoga studios, the little gyms everywhere, LA Fitness, and we really want everybody to be safe and be careful. We want to keep health and wellness alive and prospering and get out of this together.
Thank you guys for your time. Just having the resources and kind of seeing some faces behind it all really, really helps. So thank you.
And if any of you have questions that you know, on certain things that might come up and you're uncertain, feel free to reach out to any of us. That's part of our roles, is to help in the community. So please call. I think Sarah's put all the information out there, so you might hang on to the phone numbers, and we'll be happy to help in any way that we can.
Yeah. Call, text me, email me. I'm happy to help. I want us to survive this, and I want to see everybody, and I want everybody to feel comfortable to go to their local gyms, yoga studios, bar studios, and work out and feel safe and not keep spreading COVID within those areas. All right, well, I'm going to stop our recording.